Good day. On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I'm Dr. Dangleben. This is your daily educational tidbit. I want to talk about vitamin D, right? A lot of people ask me about multivitamins. Should I be taking multivitamins? Should this and this? Really, if you have a good, solid diet and you're balanced, then there's really no need for additional vitamins. But not everyone eats a proper diet, especially with all the processed foods, right? And you don't get enough essential vitamins, such as vitamin D. And that's what I'm going to talk about. You need your magnesium, vitamin B12, iron, especially in young women, and zinc and folate and these things, right? So a daily multivitamin can fill the gaps, right? Especially with people with restricted diets. And I must say, for example, vegans, all right, and the elderly and heavy menstruating women and things like that, right? So it's important because multivitamin can really boost your immunity, your energy level, especially the B vitamins and iron, right? Calcium and vitamin D and magnesium really support your bone health, right? And vitamin E and things like that helps with skin and your hair, right? So that's important. But I want to get into vitamin D real quick because I think there's a real misconception amongst us that we get sufficient vitamin D from the sun. And I think that's been misclassified and some misinformation through the years, right? The problem is melanin actually reduces vitamin D production, right? So black skinned people needs 5 times the amount of sun to produce the same amount of vitamin D, right? And remember that the darker skin you are, the darker the skin you are, where you are on the equator, the sun strength, all these are important. But many people don't make enough vitamin D from the sun. And vitamin D, and this is what I want to emphasize, vitamin D deficiency is very common in black people because we have a high melanin content. And this is what I want to hear. I want people to hear, right? So you might think, well, the misconception is, oh, you're black, you have melanin, you make more vitamin D. No, that's not true. Melanin is produced by a cell in your skin called melanocytes, right? And that is what determines your skin color, right? So the darker your skin you are, the more melanin you are. And the beauty of melanin is that it's more effective in blocking UV radiation. So the bad radiation that would cause cancer and things like that, melanin in our skin blocks that. But by blocking that, right, you have a decrease in vitamin D production, right? Because you need the UV radiation to get into your skin to convert the precursor molecules of vitamin D, which I think is D3, right, to convert to vitamin D. So again, I want folks to understand this. Individuals with darker skin needs more sun exposure to produce the same amount of vitamin D, right? And because you have more melanin, you have less vitamin D production. So that's why a lot of us are vitamin D deficient. When you go to the doctor, many of us are surprised when the doctor says your vitamin D level is low because we've been taught that, oh, we're black, we produce vitamin D from the sun, but that's not true. The darker skin you are, the less vitamin D you have, right? So my take is if you feel you need a multivitamin supplement, go ahead and take it, right? It contains everything. It contains the folate, the vitamin D, it contains the zinc, it contains the vitamin Bs, all that, right? So again, that's my recommendation. And again, we need to educate each other. We have vitamins at Patient Care in Chemin, Neuf, Pointe, Michel. Remember to check us out. This is my daily tidbit for today. Have a great day. Peace.